We are now recording. Welcome to Access to Integrative. Well, that was interesting. Welcome to a mindfulness experience with Access to Integrative Medicine Health Institute, the GW Office of Integrative Medicine and Health, and the GW Resiliency and Well-being Center. AIM is the first 501c3 nonprofit in the DC metro area to provide integrative medicine services to low income and terminally ill patients, regardless of their ability to pay. The office is a global leader in integrative medicine, focusing on professional development and community outreach events like this one. And the center takes an evidence based whole person approach to the health and well being services that we provide exclusively to the GW Medical Enterprise. And just a reminder that is the School of Medicine and Health Sciences, GW Medical Faculty Associates, and GW Hospital. I am sorry to say that today we do not have Nancy with us because Nancy had some things that came up. So, Dr. Misha Kogan, founder of AIM Health Institute, Chief Medical Officer of the GW Center for Integrative Medicine, and Associate Professor of Medicine at the GW School of Medicine and Health Sciences, is going to be doing everything today. So Misha will be doing his regular COVID Q&A, then moving on to the wellness talk, and then for the last 30 minutes, hopefully, fingers crossed, he'll be doing the mind body practice. Okay, Misha, what do you got for
Mhm.
us today?
Hi everybody, welcome to Friday. Um, Before we begin, as usual, if you're my patient, stay after. If you have something personal to discuss with me, we'll have time from 3 to 3:30 roughly. Beyond that, I have a couple of different topics. Of course, we're going to do Q&A, but as usual, let's start with the COVID updates, which I don't have any. I don't know if it's good or bad. COVID is the numbers are about the same. I didn't really analyze anything because I didn't feel like there hasn't been any real significant changes. So that's that. There was a decision by the CDC panel to not require prescriptions. However, my understanding that didn't really quite translate it to the state level yet. So if you're trying to get a booster, and you're in DC, for example, you probably still do need to get the prescription from your provider. I do understand that Maryland offering them without prescriptions, so you could get them there. And that is honestly my entire update. We did have a wonderful long COVID ketamine retreat. So update on long COVID, I'm beginning to become a big believer that one of the best ways long-term rewiring for long COVID, as well as gradual improvement of inflammation, is going to include a variety of really novel approaches, including some psychedelics. And I'm quite feel good about process forward. Part of this is appropriate utilization of some of these modalities is quite inexpensive. If you do this not with a very large amount of individual one-on-one time, and you do this in the groups or other formats, potentially these approaches should at some point become standard of care or at least be more merged into mainstream. Right now, they're not. Um, so I think what we should do is I'm going to keep talking about a couple of different topics that are sort of parallel to COVID while I'm going to keep screening your chat for the questions. You know the drill. Drop the questions in the chat. If you absolutely must unmute and say something, you do have to raise your hand. If you don't know how to do it, I will tell you. There's a button at the bottom right next to the share. There should be a button react. If you click if you click that button, somewhere there should be raise hand, and it's going to look like this. So I just put the raise hand there, and then you can also lower the hand by clicking lower the hand, which is just did that. All right. So that's the housekeeping. So we'll go with that. There's already a question in the chat, so I'll start with that, and then we'll go back and forth between ongoing different topics and the questions. I heard that the COVID situation can change if the CDC director approves the panel's recommendation, which require consulting a healthcare provider. Correct. Yeah, that is correct. So they initially said we're going to leave this up to the states. Then they said, well, we're going to leave it up to the individual provider. And in fact, it appears to be that this is the current CDC vaccine panel process. They want to give all of the vaccines administration away from the public health specter to the individual decisions by providers. You can imagine the degree of angst it creates, particularly in the pediatric world, as well as in some other domains where really trying to have physicians discuss vaccines seems to be a waste of time, right? Because it's just waste of time. Imagine for every shot, doctors will have to talk to parents about every childhood vaccine. You can imagine what that would mean. It would mean there will be a dramatic drop in total childhood vaccines because there's simply not enough pediatricians to handle all this volume. And they were very clear. They said it needs to be a healthcare provider, which is physician in the way because only physician assistants, nurse practitioners can prescribe injections. So that pool of providers is going to be not large. And those are typically primary care providers who are already stretched thin. And as you know, US does not have a primary care system at all. It's completely been dismantled in the last 10 to 20 years. Even in a great city of Washington, D.C., we have a huge shortage of good quality primary care providers who will accept insurance. There's plenty of those who in a concierge or will charge you out of pocket. But for primary care, there's shortage everywhere. There's shortage in largest cities. And it seems like it's insane, but that's the system. So yeah, it's just not working. We don't have primary care model in US. I can go into great detail why that happened historically, if anybody is interested, and sort of why we're in this mess. It has to do a whole lot more with global history here than with the current politics. Trump is icing on a cake here in the sense of that they continuously dismantling it, but it was already dismantled way before that, simply by the overall strategy. I don't know if anybody's interested in the history here, but I'm just stating the fact. I'm not trying to explain historic precedent here. I don't necessarily want us to waste the time. Okay, all right. So since there's at least one person interested, I'll just spend a couple of minutes on this. So back in the 70s, there was a very large interest in setting up aggressive, effective primary care models. In 1974, there was a very famous in Alma-Ata, which is I believe it's a Kazakhstan. It's Kazakhstan or Tajikistan. I always get those two confused. Pardon, and I used to live in that part of the world, and I don't remember now. It's not a Russia. It's one of the Asian. Well, it's either um, both Tajikistan and Kazakhstan used to be the part of Soviet Union. When Soviet Union fell apart, they became separate. But back in the day, this was part of Soviet Union, and it was a very large conference, international conference. Every single developed country attended it, Russia included at that time, that said, look, how do we create the effective countrywide primary care models? And the take away from the conference was the following. You have to create the networks. And so the places, Russia included, created very effective networks. In Russia, they call them polyclinics or polyclinics. And basically, you're born and you automatically get assigned to the center. So when I was born, I had a doctor assigned to me at the moment of the birth, and that doctor followed me for first 18 years of my life. And I would see the doctor at least twice a year, not because I was sick, but because that's how the system operated. And everybody were born, and the polyclinics were 2-3 blocks from every house. Basically, they had tens of thousands of them in every. They had to be built based on population. You had a town, you have at least one. Um, Cuba did the same. Now, Russian healthcare system totally fell apart. It was a total mess. But the certain parts in the world, Cuba is a great example where that extremely succeeded. So now Cuba has one of the best healthcare systems in the world, particularly for primary care. You can arguably say they have a very big shortage of resources and complex things they cannot do, like some advanced surgery on brain tumor. But because they have such a profoundly effective primary care model, most of the self-resolving things that don't require a lot of care are effectively managed. And so they don't let those things that are early chronic diseases progress to the situation we're in here, right? So because we have tremendous amount of chronic illness that's basically not managed, that managed with pharmaceuticals that don't have any real place to be there as a first line. They should be second, third, or last line, but they're always there as a first line because primary care providers don't have any time to really manage this right. They don't have resources of, lifestyle coaching. They don't have resources of groups, et cetera, et cetera, et cetera. So you all know this. I'm not telling you anything new, but I'm leading you with this, that US was the only country out of all of that meeting that said, we don't need this. We're going to design our own system that's simply going to say, we're going to have enough, we're going to train enough specialists, and they're each going to manage their own problems. So like if you have diabetes, you have endocrinologist, and this model completely failed. It so dramatically failed that there's no conversation. And because there hasn't been any political will since probably mid-90s to do something about it, we are where we are today. You can arguably say, well, that will has to include single payer healthcare system or some kind of a universal coverage. Sure, I agree with that, but that's not the only issue. The issue is how the providers are trained. Providers are not trained in the healthcare systems. They're only trained in prescribing. They're not trained in effective development of the programs that will prevent diseases. They're only trained in prevention where it's financially incentivizing for the system. So secondary screening exclusively, colonoscopies, mammograms, things like this. Those are not preventive strategies. You have to understand that there's no preventive healthcare system in the United States. It doesn't exist. Secondary screening has nothing to do with prevention. The only prevention we actually have in this country, which just got completely dismantled with the universal vaccination strategies, and they just got killed off. In previously, like if you think about this, how can I prevent colon cancer? Colonoscopy has nothing to do with that. Colonoscopy is an early screening. You can find an early cancer, that's nice, but that's not prevention. Okay, so let's be frank, we don't have preventive healthcare model in this country. And since vaccines are, who knows what will happen with them, that is dissipating even more. So sorry, I took a couple more extra minutes to explaining this, but I thought this was helpful. All right, any other questions on COVID? Otherwise, I'm going to gradually move to some of my other topics I prepared for today. Okay, all right, I don't see anything. Okay, so I'm going to talk about a couple of separate topics. And again, they're sort of not necessarily related to each other. It's just what gradually has been evolving in my work directly. So first, I want to show you those of you who were interested in coming to last Saturday's 90-minute mysticism and healing event. I'm gonna give you a link to the YouTube now because we just posted it there earlier this week. So if you're interested in this, come check it out. It's full 90 minutes recording. You can listen at your pace. I believe that there are some here. You can scroll through it as well. Also, YouTube is now allowing you to speed things up, which I didn't know, but now you can. So you can be like Audible. You know how you can Audible books, you can listen to 1.2, 1.5 or 2, which is how I do it all the time, much faster than the usual speed. So you can do that. So this way, instead of 90 minutes, you can get through the thing in half a time or 30% faster or whatever. So that's there now. This was a really interesting event. We definitely going to start planning more. Fred, who was the artist, who was doing the voice and music, he's going to start recording short snippets for us. And aim is creating a platform how this is all going to be communicated. So this was first event. It went quite well. There are great questions. I think I got carried away a little bit a couple of times. It's okay. I'll get better. But point is that I hope you're all going to get excited by that. Please, if you have any comments, a couple of ways you can do this. You can message me the comments, you can email them. You can also go to YouTube, and if you're savvy enough, you can put the comment on YouTube videos. It's quite easy to do, actually. There's a place where you can just put something in next to the particular video and say, I'd like to see this, or, well, that part didn't go well, or whatever. So, so that was my first little blurb. Okay, next we're going to go to something quite interesting. So in the last couple of years, you may have seen a rather increasing amount of conversations about organ meats. There is several protocols out there, including Dr. Terry Wall's protocol of curing of multiple neurologic disorders with organ meats as a core staple of the diet. Now, that may sound insane to some of you, because I bet that when I say organ, some of you immediately thinking, oh, whoa, 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 we don't need brains, right? Because there's mad cow disease. No, we're not talking about the brains, but we are talking about lots of other organs. We're talking about pancreas, we're talking about the liver, we're talking about kidneys, we're talking about lungs potentially to lesser extent, and heart. So yes, I'm literally telling you that there is enough side data to say that organ meats are probably the most nutritiously dense foods we can consume. And yes, they've been touted as a cure for a number of diseases, particularly in chronic neurology. So if you've ever seen Dr. Walls, I highly recommend for you to listen to her life story. She was diagnosed with MS. She was on the way out. She was basically in wheelchair, not moving, and she said enough is enough, and she created this process where she eats, basically it's a modified paleo diet with lots of organ meats, and within about 3 or 4 years she cured her illness. Now she's completely vibrant, walking, no illness, no medications used. So it's insane by the sound of it, but it's actually not. Now, I'm not advocating for all of you to run to the Whole Foods and buy a liver for various reasons. Liver is probably the realistically only organ you'll be able to find everywhere. First of all, it's expensive. Second of all, you must get it organic. Third, if you're not used to this kind of food, whatever I say today won't matter, because it's a very particular food. I will tell you, I have a good experience how to convince people to eat it or not to eat it. Out of my 2 teenagers, the moment they hear mom starting to cook liver, both of them tend to be running out of the house. We get to convince them that this is a healthy food, although the younger one is beginning to sort of tease out that there's some forms of preparing this that he can tolerate. The older one is like, through my dead body, I'm not eating this shit. So, yes, so there's that. Now, the good news is that I just recorded a podcast with a company that literally created a dried freeze organ meats, and they selling it as a seasoning. They're also selling it as just a powder. So if you don't want a seasoning, that's fine. You can simply get it in a purified powder form and then just add it to any meals. Also, if you just go to a particular, like to different supermarkets, let's say Whole Foods, I put the link to the company in there, and I just recorded a podcast with the person who started this company. As soon as the podcast is out, probably next week, I'll make sure that I'll post it. It was a really interesting podcast. You can buy typically dried liver in different stores. So this is not the only seasoning, of course, out there. My only strong recommendation is make sure that whatever the organ meat you're going to buy, it has to be organic, particularly liver and kidneys, because those are the organs of detox. You just don't want to eat routine, conventionally raised organ meats. So H Mart on it, you're not going to find organic organ meats in H Mart. I can guarantee you that they don't sell that. We already tested it, checked it out. We typically buy it in Whole Foods. Sometimes Trader Joe has some more organic meats, organic organ meats. We mostly cook liver. Everything else, sometimes you're able to find hearts, and on a really, really rare occasion, you can find something else. But the hearts, particularly chicken hearts, are easy to find. Again, those not going to be organic, um, and to me, hearts are the really, really tasty food. In fact, the hearts and the tongue are those two the most tasty foods, in my opinion. But again, I know I'm grossing a lot of you out. Bear with me. The point of this conversation is not about the taste. You can have a completely different taste. Maybe you're vegetarian. This whole conversation should just be ignored. But for those of you who are not vegetarian, and if you, I just want you to run through this. And why am I talking about this outside of some crazy stories like the story of Terry Walls? Because I see a tremendous need for a very concentrated nutritional products that are not supplements. Why? The supplements are not going to get absorbed and assimilated exactly the same way as the foods are. So this freeze-dried organ meats are going to be absorbed way better. Same goes, of course, if you're going to cook the food, right? So if you're going to buy organic liver and then cook it at home, again, the absorption is going to be much higher. Also, think of it this way. Even if the food is freeze dried, you're still getting almost every single nutrient in there. In fact, those of you who remember Dr. Frame's last presentation when she talked about vegetables and fruits, she made a very important comment that often frozen food is a good food, especially if you don't have an access to very high quality fresh produce. Because often you're going to have a better quality frozen food, especially if it was frozen right away and it's organic and it's delivered to your store frozen. You actually going to end up preserving more quality nutrients in there than buying, conventional apples, for example, that have been sitting on a shelf for, 3 months and a lot of nutrients already leached out. So don't worry about foods that are in processed in the certain ways like this. I wouldn't call this processing being in the same category as, for example, you know, frying food in a McDonald's, right? So this is a different type of processing. You're preserving the nutrients. It's much closer to the only traditional preservation methods, which are thousands of years old, which basically are drying and fermenting. Those were the two only effective preservation methods back in the day, which are, in fact, some people think that freezing is even better because freezing preserves more nutrients than, for example, like an air drying or a sun drying. So, all right. So I see questions coming up, so I'm going to just kind of go back and forth now. What about chicken livers as a food source compared to other livers? Great. Get organic, absolutely fine. They're going to be very nutritious. Obviously, there are going to be a lot of them, so you're going to have to learn how to cook them and eat them differently. If you're getting a cow liver, for example, it's going to be a pretty sizable chunk, and one liver will feed the whole family probably more than once even. So, accordingly, when you're getting chickens, interestingly, chicken livers are very cheap, chicken hearts and livers. And sometimes they were so cheap that when we sometimes run out of frozen food dogs that we buy for them, we would just buy it for them and just boil it, basically. We wouldn't give it raw because we don't know where that comes from, but we'd give it boiled to them. Okay, H Mart, are there any organ meats that won't trigger gout flares? That's a good one. I would just simply try the dry freeze dried. There's a good chance it will not, because when you eat a fully prepared organ meat, you are getting one of the biggest things is that you're stimulating the uric acid production quite a bit, particularly with liver and kidneys. I would expect a lot less effect of that from the powder, and also you can take a little less of it. So one of the benefit of seasoning, you put it in a fridge or even not, and it just sits there, and it's going to be shelf stable for a long time while you're still getting all the nutrients. You don't have to take a lot. You can take a little bit, but you can just season your food almost every meal. So this way, you're going to have a smaller bursts. The gout is the burst disease. If you drink a quarter of a cup of beer, you're completely fine. But you have 2 cups of beer and you have a gout. So it's the same kind of principle. If you take a little bit of a nutrient continuously, you're probably going to quite dramatically support the system. If you follow the link, the eat block, you will see the ingredients listed in there. There's really nice table that basically tells you in terms of like a regular seasoning versus their seasoning. Like, for example, 1 teaspoon of the plaque will have 5 milligrams of iron, for example, right? I mean, you would expect that, right? You would expect the product like this to be kind of similar to any other sources of meat. So you would expect some nutrients in there that would be in other meats, but there in some nutrients will be even higher concentration simply because organ meats contain more particular nutrients compared to just muscle. of the animal. So that's like, for example, phosphorus. This is one of the highest phosphorus and potassium rich powders you're going to find there. 1 teaspoon has 600 milligrams of potassium. I mean, that you will have to have a really hard time getting this much from any other sources. So just FYI. And pretty, you could also a lot of sodium, obviously, right? So if you take a teaspoon of the seasoning, there's going to be a lot of sodium. So that's not going to, they still have a little bit of salt added just because it's a seasoning. So if you have hypertension, you're going to have to watch out. But again, you can watch it out based on like 4 grams of salt per day. If you're hypertensive, maybe too much for you. But if this seasoning is the main salt source you're using, you can effectively coordinate that because you know the exact amount. All right. Where is the salt? I'm not sure what the question implies. I'm something I grew up eating organ meats. Okay, good. So for you, it says, yeah, so the liver has a lot of, well, actually any organ meat will have a lot of salt. So you do have to watch out for that. So that's one point that needs to be made. Okay, the name of the person that healed herself. Okay. Terry Walls. Terry Walls. And I'm gonna see if I'm gonna quickly put in, try to find her website. It's called Terry Walls Protocol. Here, put her name in there, and I'm gonna give you a link in a second. It's interestingly, she is now she's an academician, so this is like a real deal. So she's not in contrast, a lot of people like her often end up going into the industry and then making a killing. She didn't. Mostly she stays academic. So here's her on website. You guys can probably take a look at this. It's a name it's good to know. It's one of those names that pretty fascinating. I find it extremely comforting to me that I can sit in front of you and at the same time, when I talk about Terry Walls in the back of my mind, thinking, well, what about Dean Ornish, right? Who basically advocates for vegetarian diet and, his work, I don't know if I'm spelling this right. I think it's like this. And his work has been very, very clear that if you follow his approach of combination vegetarian healthy diet with exercise and mind body, you're cutting down risk of cardiovascular disease by 90%. So he published this. He got a Medicare approve his program about 10 years ago. And I think I mentioned this on this channel that despite the approval, nobody uses his program. Nobody. Like there's not a single institution in the country that adopted his approach and accepts Medicare for it. Why? It's much easier to keep robotic surgery open and do this stents and cardiovascular procedure and make 10 times more money per unit of time invested than implementing Dean Ornish's program. It's our misaligned incentives, which are bringing me to the next point. You're all going to be guinea pig in a 5 minute. So, but I want to see if there's any more questions here about this or about COVID, because then that's my next topic. We're still going to do at least 20 minutes of practice, so don't worry. Still have 10 minutes. Okay, any other questions on any of this? So I don't think the great question. So Karina's asking critical question, and I always wondered if anyone's ever going to do this research. I feel like it's going to be fundamental research, but I have a bad feeling no one ever will sponsor something like this because it's so critical. So basically, question is, has anyone ever compared side by side in controlled trial vegetarian diet versus paleo? Or versus, for that matter, even for like modified Mediterranean. Now, there have been studies comparing vegetarian to Mediterranean, and the data is very inconclusive. There are more studies showing Mediterranean diet have better outcome long-term than vegetarian. However, these studies are very difficult to interpret carefully. Most of these trials were not done correctly side by side. You cannot randomize something like this. How are we going to randomize this? I mean, people are going to know what they're eating. They're going to immediately figure out what diet they're on, right? So you may be blinding the providers who are running the study, but not the patients. So you cannot ever do the double-blind randomized control trial based on this, right? And the paleo is even less. There's very few studies on paleo to begin with. A study like this would be fascinating. Will it ever happen? I seriously doubt it. If it will happen, it will not happen in this country. I think there is a very interesting political divide between the vegetarian camp and some other camps. I'm in no camp. You all know me. I support my patients, and I think that for a lot of people, vegetarian diets are great. I feel for a lot of people, they're not great, and everywhere in between. And every person should ideally test different diets, see how they feel the best on what specific diet. Make sure that it's not just how you feel, but also that your biological markers, that your metabolic markers are also good on a particular diet. Like for example, I can eat pretty sizable amount of meat, and my LDL does not go over 100. Just me, right? And my my wife is, for example, not like that. So a little bit more meat and her cholesterol shoots up. Why? We're all different. We all have genetically different setup, and we have to honor that. And that's basically the point. Okay, how do you test and track your markers? Well, there are all kinds of ways. If you have a good provider who understands what metabolism and prevention is, then of course you can work with a provider. There are new systems. The Forward, of course, is probably the most out there. Forward is the new model where you couple times, so it's a membership program, couple times a year. They test your entire metabolic parameters. I think each round is about $300. Maybe I'm off. Somebody can Google this up. If Stephanie is here, I'm sure she would be happy to help us out and look it up. Steph, if you're here, just put the link to Forward in the chat because I don't want to get disrupted. I'm afraid I'm going to start spending time searching, and it won't be good for us. So, but it's Forward is not the only model. There are other models. I think some providers in One Medical tend to like to do this. There's an increased amount of interest in general public, and of course, because of that, the whole field of anti-aging, for example, or healthy aging, is where most providers who think of themselves as being in that cohort of providers will, of course, offer some routine metabolic tracker maintenance observation. I have my own system that I think of it my way. Doesn't mean it's the best way, it's just my way. And there's no real standard here, right? Because the field of anti-aging is not standardized. There are some people for whom anti-aging is all about peptides and hormones. Some people in healthy aging community don't even want to talk about that. I'm much closer to that second category, by the way. I mean, I use some peptides occasionally in my practice, but most of it I think should be lifestyle and some integrative approaches, and not really some advanced techniques like stem cells, for example. So I think those should be really more like a last resort when everything else is done. All right, so, and now I'm going to give you a little preview for something. I felt like since I'm doing everything myself today, I need a little bit of a practice. So I'm going to practice on you. So those of you who've been with me for quite some time know that I'm trying to get on TED Talk. And my TED Talk is all about polypharmacy. And so what I was thinking of doing, I'm going to give you a couple of minutes spiel. Now, that's not a full TED Talk because I haven't even started. First, in order to give a talk, you have to get in. And that's not a simple process. So I've been applying to more than 30 different TED Talks. I only had one interview and they didn't pick me. So it's a process, I just keep going. But I feel like it's a really good practice since you're here. And I actually think it's an important topic. And I think many of you will relate to this topic. And, if you have questions about it, we're still going to have a couple of minutes. So I'm probably going to go for maybe 2-3 minutes, maybe not even that. And also, I wasn't specifically preparing in great detail. So this is going to be kind of a combination of a couple of things. So, all right. Well, hi everybody, and we're going to pretend that I'm giving this in a college. So you're all students, right? It's important because my Stephanie says she's not seeing Forward anywhere. Forward is a system. It's a relatively new system that does this screening. Okay, we'll come back to that because I don't want to get disrupted. I can always find it later. So pretend that you're a college student and that this talk is in college. And that's because the only interview I had so far was at the University of Gainesville. And actually getting interviews pretty hard. They had 60 applicants and they only selected 15 out of 60 to do the interview. And then they only selected 7 people to actually deliver the TED Talk. So I didn't end up in there. Okay, so you're a college student, and we start with that. So let's talk about you, a 20-year-old tonight, college student. And think of it this way. If the current medication harm stays flat across your lifetime, the polypharmacy, defined as taking several medications, particularly the more modern way of talking about polypharmacy is taking 5 medications or more, and hyperpolypharmacy, taking 10 medications or more. So if you're 20-year-old, your lifetime risk right now of dying from polypharmacy sits at around 4%, or 1 in 25. But that assumes something critically important. It assumes that over your lifespan, which probably, let's say, could be 60 years, if you're 20-year-old now and you're going to live it to 80, you have 60 more years. The problem is that in reality, in the last 20 years, polypharmacy more than doubled. And if we continue with the trajectory, by the time you reached 80, your risk of dying from polypharmacy could be upwards of 25 to 30%. 1 out of 3 to one out of 4 people within the next 50 years will be dying from taking medications, not from errors, not from any kind of complications of illnesses, but from the medication side effects directly. These are not statistics that politicians are comfortable talking about. Over the past 10 to 15 years, multiple organizations in the United States have aggressively tried to deprescribe. American Geriatric Society in mid-2010 created the whole pathway of political advocacy to try to teach deprescribing methods to politicians. Instead of seeing benefits, we're progressively getting worse. There are multiple reasons why that is the case. One particular reason is the fact that we are not utilizing healthier and safer methods first. Our entire healthcare system is falls onto a pharmacological methods as first approach. When you get a new diagnosis of any chronic illness, most physicians will not come and talk to you about the diet, non-medical management, maybe meditation, maybe exercise. Very few will. Part of it is because we're not trained. We're not training next generations of physicians, and yes, we're training them a little bit better now than 10 years ago. But the sheer volume of influence of the pharmaceutical industry is too great. Every year, there are way more budget goes into sponsoring more clinical trials based on medications than any lifestyle methods or any integrative methods. So what is the path forward? It's this gloomy. Even something very benign like an antacid pill can increase risk of dying by 30%. I'm talking about very common medications like omeprazole. Anyone taking omeprazole has a 30% more chance of dying from just taking this pill if you're taking it indefinitely, if you don't have a stop point. I'm telling you all of this information not to scare you, but to say we have to have a way out. There's very simple integrative approaches for the top 5 most dangerous medications. And the top 5 most dangerous medications, in addition to the proton pump inhibitors, which I mentioned, the antacids, are the pain medications, benzodiazepines, or hypnotics, sometimes we call them, okay? Tranquilizers, which are often used in severe psychiatric conditions, but they're also heavily used in patients with cognitive decline. And NSAIDs, even though I sometimes consider NSAIDs being pain medications, but NSAIDs and anti-inflammatory pills like Motrin, they kill about 16 to 17,000 Americans every year, year after year. And again, statistics are getting worse. And so how do we get out of this? Well, first of all, every time you get a pill, you have to double, triple question the intent. Why am I starting to take this? Do I really have to take it? Can I get out of this and not take it? Is there other method that's safer that I can follow? That's one. Then that's on you. And you can do that already now. Number 2, learn your health. Learn how to anticipate problems, prevent them, or intervene at the very early phase before your doctor says, well, look, you progress now, we have to start the pill. Because quite often, early interventions as a preventions work a lot better by the time you get to the point where you're already past that opportunity of putting non-pharmacological method for first. And of course, we all have to become advocates. We all have to go to the Hill in one way or another. You don't have to physically go to the hill, but you can amplify the message. You can talk to other people about this. You can talk to your friends who are seemingly taking too many pills and advocate for them to go and find another provider who will be helping them to get off of these pills. And lastly, I expect a major revolution with the new AI. I'm currently myself engaged in an AI startup that teaching AI how to deprescribe using integrative approaches. We're already starting to gradually pilot the system at George Washington University, and I hope that in the next few years we'll be doing a lot more of it so we can actually show you the data. But again, I'm going to come back to the fact that it has to start with individual. Double, triple check every pill, whether you are going to take it or you're already taking it, it doesn't matter. Any pill, even if you only have to take it irregularly, even irregular medications increase risk of problems. I hope this was helpful. Thank you very much. Now, this was a little bit longer than I expected. I got carried away. I probably spoke for about 7 minutes roughly. So, the typical TED Talk is about somewhere between 8 to 12 minutes. Yeah, Verona, I'm going to unmute you. You have to unmute yourself first. There we go.
My reaction, if I may, was I would really love to have those statistics because I've had so many doctors tell me about NSAIDs and I won't take them, but I would love to be able to hand them something with the stats.
Yep. So everything I told you is heavily evidenced. So that what I didn't tell you is even scarier numbers. For example, that the medications in 2025 moved to be a third cause of death in America, with 250,000 dying every year.
So where can we get those statistics we can tell the doctor and they'll
And
believe us?
you can take 30 seconds and Google what I just said. And I
Just
can
Google it.
just
Okay.
Google it, but I can give you links if I'm gonna
Yeah.
give you a couple of links right now. And by all means, I'm in the middle of submitting application to Princeton. So I'm gonna just give you this, what I just typed here, and that may be a good place to start. And I'm sorry that Horvath is, okay, so it's kind of long, it's gonna get cut off, but oh, it's not letting me. Hold on a second. Okay, so I put statistics not for the management, I put statistics of the problem. Now I have a similar file with the management information, which actually, so all of this data has been around. There's nothing, absolutely nothing here that is not known to wider expert populations. All of this is a common knowledge. A lot of this links and a lot of this studies. Look at the sources of material. It's a JAMA. So if you cannot reach the site, sometimes it's because your browser wouldn't allow you. So sometimes there is certain abstracts, like the first one is actually working on my computer. So if you can't get in, is that something with the browser? The JAMA network link is correct. So is the NCI, the following study. It's also correct. Now that second pause where the link is to neurology, Practical Neurology Association. So they are the ones that claimed as of March 26, 2025, that medications are now third leading cause of death in US, with roughly of 250,000. Now, notice, this is not including errors, okay? So this is the total amount of adverse events combined. So this includes drug overdoses, prescription drug misuse, drug-to-drug interactions, allergic reactions, et cetera, et cetera, et cetera. And that's it's not even accurate, most likely, because as you can imagine, the statistics are often highly, highly underreported. No hospital will ever report typically that they killed the patient by another prescription. It's always get hidden. So this may be highly underrepresented. The reality may be grossly worse. We just don't know. You look at some more conservative data, like this second data from NCBI that's posted in the first section. under, oh, that one cannot be reached. Oh, interesting. Okay, so I'll have to redo this one. Thank you, whoever pointed that out. Huh, it's interesting. Why would that be the case? All right, I'll have to come back to that. Good. See, this is why I had to do it, because I wanted to double check all this. All right, so I'm going to take a couple more minutes here, and we'll go from. Why? So interesting. Why would that link not work? Okay, well, I'm going to copy paste it now. Here, this is the corrected link. Thanks so much for whoever posted. Something got cut off, probably. Anyway, see if you can test this last one that I posted. That should lead you to Polypharmacy in older adults and a narrative review of definitions, epidemiologic and consequences. This is the 2021 study that basically confirms the 40+% risk. And also pretty interesting that every random medications added on increases mortality on average by 3%. So if you're taking, say, 5 medications, starting with the second medication, every single pill bumps up the risk. Again, this is highly averaged. This is more interesting, not for you, but for, people who are more in a public health sector, because for them, that's more important information. All right, so I don't want us to be hanging with this because it's a green topic. So we're going to practice. We're going to practice one way that helps to deprescribe. And by the way, look at the chronic pain links. For example, one of them describes the one of the more recent studies on utilizing non-pharmacological methods for chronic pain. So, all right. And mindfulness is included. So Nancy wanted to do, Nancy Kaden, she hopefully will be back. She's one of our senior Sufi teachers in this area, but she is also social worker. And, oh, okay, Randall has a question. All right, Randall, let's do a question and then we'll do the practice.
Oh, hi. Sorry, I asked it in the chat, but maybe you didn't see it. Just I wonder if you could answer a quick non-COVID related question. Yesterday I noticed in the evening my ankles were swollen, which I've never noticed before. And to your point about the primary care situation, I still don't have a primary care doctor, but I do see a cardiologist, even though I don't have any known heart disease. Do you think that they could handle that kind of thing? And
Absolutely not.
Not.
Absolutely not. You go into a butcher, you will never buy a salad. Remember what I just said. They're absolutely not trained to handle this. They have no tools. They would not handle, for example, the fact that you may need a prostate cancer screening tool applied to you. So this is the mess we're in, because there are a lot of providers who sometimes believe that they can be substituting for somebody else, and it's only partial yes. Our system is so infinitely more complex than 20, 30 years ago that unfortunately, without a very careful, I mean, ideally, honestly, I would have every single 65-plus-year-old patient in this country be having access to a regular geriatrician in addition to whatever specialist they need to have. But it's impossible. There's just not enough of us.
So I need to get this checked out, I guess, right? And I need to
You have to have an internist or geriatrician, because you just don't know what can come up and what can happen with you. Having an expert who is not trained in most of the conditions that can happen to you is inadequate. And that's and Randall, don't think you're in any university that you're some kind of a unique in here in that sense. This gap exists in somewhere upper 70% of all the US population, that they don't have appropriate access to the healthcare system. You're living in a DMV area. So in essence, if something bad happens to you, you're going to be okay. You can quickly access the care. Now imagine the same situation and you're living in a rural Montana, no particular reason why I said that, just first thing that came to my mind. And you don't have any access to a clinician for 20, 30 miles around you. The nearest hospital maybe 45-minute drive or more. So, that's the problem. And having a very effective acute care management system is great, which is what we do have. We do have a decent acute care management. That is past. That's in the past. We solved acute care problems a long time ago. That's not what's driving the healthcare expenses, weighing down everything and causing chronic worse mortality overall. It's not mostly acute. And acute care we've gotten really well with. Our healthcare works really well for that. You have a fracture, we'll fix you. But if you're going to start developing chronic illness like chronic neurologic disorder, there's not much that can be offered. The treatments generally are, and not just because the treatments don't exist, but the system often doesn't support the treatment model. That's the part of the problem. So
Just a real quick follow-up, is that something I really need to get checked out? I mean, is that like
they're about it. I'm presuming you're over 65.
yes, I'm
So
71.
you have at minimum of 20 different things you have to check out.
But I mean, the swelling specifically, is that something that needs to be
Well,
checked?
swelling specifically, you can talk to a cardiologist and be able to refer you to. But there are things with your health that you don't even assess. The
Right.
bones have to be assessed, the eyes have to be assessed, the skin has to be assessed. Certain cancers have to be assessed, like you have to get screening for colon cancer, prostate cancer. That list is quite long. You have
Mhm.
to make sure your certain vaccines are up to date. You have to make sure certain blood work is run regularly. Like there's a lot of things like this. By the way, whoever posted naturopath, so naturopath can be a wonderful primary care doctor. They are trained in primary care. Guess what? Medicare does not cover naturopathy in any state except for, I believe, 2 or 3. Definitely not here. Medicare does not cover naturopathic visits in any DMV area. So, exactly, it's not in my plan.
Okay, thank you.
Yep. So still, you don't have a choice. Good luck finding a good geriatrician. It's going to be very difficult. You best to be finding a good internist or paying out of pocket to a naturopath or somebody else, if you can afford it. So yeah, we're all left out to our own devices, people. You all have to create your own healthcare system in essence. You have to find your own providers that will fit your particular individual needs. Those of you who are my patients, you're probably feeling slightly better than other people here, hopefully. And not necessarily that I'm claiming I'm the best doc. That's not the point. It's just because you have somebody who's actually know and care about you in that sense. And Randall brought up a great point, right? So his general primary care has been addressed by cardiologists. Okay, that about sums up our entire healthcare system in one line, right there. So, and maybe that cardiologist is an amazing person and doing a great job. That's not what I'm trying to say. I'm saying that in any other effective healthcare delivery system, any European country, for example, that just won't happen, right? You just won't happen. They will have a system that is delivered better. Correct. So, Karina, you're 21, regular primary care. Good news, you're very young, so you will not need to be seen every year. You could be seen every 5 years for a checkup and basic blood work. So again, as we get older, our amount of medical screening and needs goes up. I turned 50 last year. I need to get colonoscopy done. I'm procrastinating. I know I have to, and thank God I'm inside the healthcare system. I can just phone my head of our gastroenterology in my own institution and get on her schedule. But life is such. But my point is as we all get older, we're going to have increased amount of this needs. And so for Karina, having a regular checkup once every 5 years with even nurse practitioner or PA would be perfectly great, perfectly fine, presuming, Karina, you're healthy. Now, if you're not healthy, you have chronic illnesses, everything changes. Okay, I really want us to do a little bit of practice. So, because otherwise I'll feel myself unbalanced. I've been talking for a full hour about stressful things. It's not the right. We don't do that here. So center, find your center. Put your feet on the floor. If you're sitting, if you choose to lay down, just get comfortable. Nancy asked specifically, she wanted it to do elemental breath, and then she also wanted to do a guided imagery. So we're not going to do guided imagery, but we have 5 minutes to practice elemental breath. I personally feel it's really important we honor all of the elements inside of us and that we acknowledge when each element is not in a great balance, and spend a little bit more time to try to re-establish this balance. So we're going to start with the earth, sensing feet on the ground if possible, sensing inhale through the nose, exhale through the nose, and imagining that the breath is coming through our feet into the base of our spines, and then exhaling and returning the breath into the earth. And here you can concentrate on any impurities, the physical impurities in your body. Maybe you have a pain in a particular spot. Maybe you're carrying tension, like I'm been talking for so long, I feel my eyes are tense, my jaw is tense, my forehead is tense. Interestingly, my stomach is not. So I'm going to inhale into my forehead and then exhale and try to just release the tension there. And we'll take 2 more earth breaths. And let's move to the water. Inhale through the nose. Exhale through the mouth. Imagine being put in a body of water. Maybe it's a lake or a creek. Maybe it's your shower. Imagine that the water is running through our body, around our body, washing every cell, every space, the blood, the lymph, spinal fluid, every fluids in our bodies are constantly moving. So let's inhale through the nose, exhale through the mouth, and imagine all these impurities on a cellular level are being washed away. It's also very important that you feel whether or not you are lacking fluids, if you're getting dehydrated. Many times we don't sense this well. So tuning into our relationship with the water element more is very important, because it can help us to stay better hydrated and to anticipate when we should be hydrating next. Maybe you get a little bit of a dry throat. Maybe you just know that you need to drink a little bit of water every so often, whatever it is for you personally. Okay, let's take 1 more water breath. And we'll move to the fire. So inhale through the mouth, exhale through the nose, and place your attention into the area of your heart. Imagine that heart being a center of our emotional lives, place where our intuition comes from, place where we often make decisions based on our emotional reactions. So balancing emotional underpinnings is very important, and the fire is a great tool for that. So inhaling, imagining fire growth with each inhale. And then when you exhale, you can imagine that there are any emotions, any feelings that are not serving you well. Maybe you're frustrated about politics. Maybe you're scared for your relatives, or maybe you're fearful about your own health. So let's let go of all this for a few minutes. Put these emotions into the fire of our hearts. Let them become ashes and exhale them, letting go of attachment to important world of emotions. We're not getting rid of anything. We're just for a time being detaching ourselves from this. They'll come back. Let's do one more fire breath. And we transition to the air. Inhale and exhale through the mouth, concentrating on the mental plane of our being. You could imagine concentrating in your forehead, your third eye, paying attention to the thoughts that coming to your consciousness. Here I love analogy of clouds. Our world constantly is filled with different thoughts. Maybe there are things you need to do after the class. Maybe you're thinking of next thing on your agenda for today. These are all temporary constructs. They're gonna pass. So let's just, for a minute or two, detach ourselves from them. And it helps to think of all that cognitive noise being clouds in the skies. We can just watch them passing by without attaching anything to them. You can always come back to any thought. You can always concentrate on your specific issues or problems you're trying to solve. But for now, let's stay with the air breath and let the thoughts flow as they are without attaching our concentration and attention to them. This exercise, this air breath, is particularly important if you're having a hard time falling asleep because your mental plane is too active at night. So this is a really good practice for you. You can always do a little bit of the air breath before you fall asleep for a couple of minutes. Okay, we'll take 2 more air breaths. And we'll do the last breath, the ether breath. The ether can be done through the nose, in and out, or through the nose and mouth together. Very gentle, refined breath. And this is the breath where we fine-tune our intuition, where we ask to purify the personal relationship with the greater, whatever that means to you. God, nature, society, whatever the non-personal aspect of your being is for you. You can also, here in this last few breaths, you can also check in with your body, make sure that if there's any tension left, you may spend a few more minutes concentrating on that and simply trying to let go of tension. We'll take 2 more ether breaths. And come back into your space, open your eyes. Let's do a little bit of I feel some tension now in my face. I think part of it was simply I paid more attention. And of course, I've been talking and thinking, so my forehead is tense. So just do a little bit of a releases. And thank you. I think it was I hope you guys enjoyed it. There's still some unanswered questions in there. Next week, we're going to have Angela. And looks like I'm giving the wellness talk, and Angela will probably do some practice with us. And Anna, for your questions for Randall, yeah, I think finding primary care, if you cannot find a primary care, at the very minimum, talk with an existing provider. So if Randall, if you have a good cardiologist you like, talk to him and say that these are your concerns. Who would you recommend me to see? Sometimes you will be surprised. Sometimes cardiologists will have connections that will help you, because it's not always easy to identify a good primary care without assistance. It's actually very hard. Lastly, you could call your insurance. For example, you can call Medicare if you have Medicare. The problem with that approach is you're going to get a lot of ghost lists. You guys familiar with that, right? There are tons of ghost lists, meaning that you call the number that they give you and there's no one there. Or provider doesn't take Medicare. Or provider stopped practicing 25 years ago. They still have it on the list. So you're going to be wasting a lot of time. There's been actually articles in the media about ghost lists they're very, very common in every healthcare insurance, not just in Medicare. So it's very hard. It's very hard. So, but Randall, if you particularly have questions, maybe we can also help you here in this. We can specifically look for someone for you. So, contact Janet. I'll see what I can do if you have a specific question. Even though practically I'm not allowed to give you any medical advice, but I can give you practical advice how to look for the advice. Nobody stops me from doing that. That's completely fine. All right. I presume, Janet, let's stop the recording here, right?